Hello students, welcome to this session. So today we are going to study about reproductive health. The speaker Dr. RAJASHREE MUTHA. The learning objectives of the reproductive health, WHO definition, then problems and strategies, population and birth control, MTP, STD and infertility. So first is reproductive health, WHO definition. So it is defined as the total well-being in all aspects of reproduction, that is physical, emotional, behavioral and the social. Now let's see reproductive health problems and strategies. So problem first is uncontrolled population. So for that strategy is the family planning program, birth control devices. The second problem is the early marriage. So strategy is or solution is sex education, pregnancy, care of mother and child, MTP, medical termination of pregnancy, proper indications, MMR and IMR, medical assisted delivery, postnatal care, STD, sexually transmitted diseases, detection and treatment, contraception, proper devices, female feticide, amniocentesis, ban for the sex determination, infertility, assisted reproductive techniques, social evils like sex determination, sex abuse. So prevention is important. The reason for the population explosion are better medical facility, longevity, green revolution, that is food is available, nutrition is available, infants, immunization, investigations, treatments are available. So need to have the birth control to prevent population explosion. So there are two methods, natural and artificial. So in natural there is safe period, that is called periodic abstinence, that is around 10 to 17 days, because ovulation takes place on 14th day, so few days before and after should be there. So periodic abstinence means no coitus or sex in the ovulation period. Then coitus interruptus, that is withdrawal of the seminal fluid before in the ejaculation. Then lactational amenorrhea, so after delivery there is 6 months period where because of lactating mother there is amenorrhea, no menses. Then artificial methods are, one is barrier, they are either spermicide cream or jelly applied over the vagina. So male condom is there, that is Nirod. In female, diaphragm, cervical cap or walls can be applied. Then physiological devices like intrauterine devices, so it is Lippis loop, it is non-medicated, or copper T, that is copper decreases the motility of sperms and phagocytosis of sperms. Multilode 375 or hormone progestasert or LNG20. Then oral contraceptives like which inhibit ovulation, entry of sperms and implantation. So the pills are there, that is Mala D, which is taken for 21 days and after that 1 week we can take the Hematinics. Then Saheli, it is formed in the Lucknow. It is non-steroidal oral contraceptive. It is taken 1 per week. Then injections are available. The permanent method for the birth control is surgical sterilization, that is to prevent or block gamete transfer. So in male it is vasectomy and then in female it is tubectomy. So vasectomy, the spermatic cord is ligated and in female the fallopian tube is ligated. So these are some of the contraception methods like condom, female condom, then oral contraception pills, hormonal ring, intrauterine device like copper T, contraceptive injection, surgical sterilization like vasectomy in male and tubectomy in female, then implant, coitus interruptus, calendar rhythm period, that is safe period, that is vaginal douche, then contraceptive patch, diaphragm or cap. These are a few contraception methods. Now let's see MTP, medical termination of pregnancy. So it is intentional or voluntary termination of pregnancy before full term is called MTP or induced abortion. It is medical way of getting rid of unwanted pregnancy. Any qualified gynecologist, MD or DGO, or any MBBS doctor with training of the MTP are allowed to perform this procedure under the MTP of Pregnancy Act 1971. It is done up to 12 weeks of the gestational age. Medical abortion may be preferred. The indications: woman's preference in very early gestation up to 49 days of gestation. Woman is severely obese, that is body mass index is more than 30, so surgical treatment is difficult. If woman has uterine malformation, fibroid, or previous cervical surgery, or woman wants to avoid the surgical intervention. The surgical abortion indications: woman's preference or the contraindication to the medical abortion. The methods used here are: first is DNC, that is dilatation and curettage, vacuum aspiration, administration of the prostaglandins. The complications of the MTP: hemorrhage, incomplete abortion, uterine or pelvic infection, ongoing intrauterine pregnancy requiring a surgical abortion for completion, then misdiagnosed unrecognized ectopic pregnancy. STD, sexually transmitted diseases. So they are of two types: genito-ulcerative disease and urethritis, that is inflammation of the urethra. So in ulcerative disease, the syphilis is the first disease, that is caused by Treponema pallidum, chancroid caused by Haemophilus ducreyi, genital herpes caused by herpes simplex virus, lymphogranuloma venereum caused by Chlamydia trachomatis, donovanosis caused by Klebsiella granulomatis. The second variety is the urethritis. So it is gonococcal urethritis caused by Neisseria gonorrhoeae, non-gonococcal urethritis caused by other than Neisseria gonorrhoeae, that is Chlamydia trachomatis, genital mycoplasmas, ureaplasma, mycoplasma, herpes simplex virus, Candida albicans, Trichomonas vaginalis, and other is AIDS or HIV, hepatitis B, that is HBV. The mode of transmission: the most common mode of transmission is the sexual intercourse, then prick or sharps needle, blood and blood components, vertical mother to fetus. The prevention are very important: avoid sex with the unknown or multiple partners, always use condoms during coitus, investigation of blood for early detection and early treatment, avoid sex with getting vaccinated early before sexual exposure, avoid sharing towels and the underclothing. Now let's study about infertility and ART, assisted reproductive technologies. WHO defined infertility is a disease of reproductive system by failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. Primary infertility, that infertility in a couple who have never had the child. Secondary is after conceiving the pregnancy. Then general causes are sexual transmitted diseases like STD, chancroid, then genetic causes, DNA damage due to the smoking, general factors like diabetes, mellitus, thyroid disorder, undiagnosed and untreated celiac disease, adrenal disease. Common causes in females: ovulation problems, that is polycystic ovarian disease syndrome, that is PCOS, which causes unovulatory infertility. Tubal blockage, pelvic inflammatory diseases like infections, tuberculosis, age-related factor, then uterine problems, endometrial tuberculosis, uterine tube tuberculosis, previous tubal ligation, advanced maternal age. In males, the low sperm count due to endocrine problems, drugs, radiation, infection, or testicular malformations. Now let's see the techniques, assisted reproductive techniques. The first is IVF, in vitro fertilization. In that, test tube baby is there. So gamete fertilization takes place in the test tube outside uterus, and then embryo is transferred to the uterus. ZIFT, zygotic intrafallopian transfer. In that, embryo of 8 blastomere stage is transferred to the fallopian tube. GIFT, that is gametic intra-fallopian transfer. So gamete from the donor are transferred to the fallopian tube. ICSI, that is intracytoplasmic sperm injection. AI, that is artificial insemination. Sperm or sperm from husband or donor is inseminated into the cervix of the female. Hope you find this session useful for your understanding and for your exams. Thank you.